Good evening. This is Dr. John Bennett broadcasting from Miami, Florida. Tonight we have another in the series of Parkinsonism educational hangouts with Dr. Abdul Rana, a neurologist and well-known Parkinsonism educator. Tonight, Dr. Rana is going to talk about leg pain in Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett.
I understand they got some turbulent weather up there again.
No, our weather is good.
Oh, it's good. Okay, maybe it's just New Jersey and Philadelphia. They got quite stormy weather. Okay. Anyways, leg pain and Parkinsonism. What are the common causes of pain in the legs in Parkinson's?
Pain in legs in Parkinson's patients could be due to many causes, especially as the disease progresses. The problem could become more prominent. Patients may notice more pain. And this could be due to many different reasons, such as sensory symptoms, like numbness, tingling, and burning sensation. Sometimes toe and foot cramping could cause pain. Leg cramping it could also result in a lot of discomfort, as well as restless leg syndrome. Some patients would report a diffuse generalized pain. Others would report a tightening feeling, tingling, or numbness and a burning sensation. Now, these symptoms could also be due to polyneuropathy, which is commonly seen in diabetics, but is also seen in patients with Parkinson's disease due to long-term use of levodopa. These symptoms could become more prominent during off periods, and it's very important to rule out other causes, such as nerve damage or radiculopathy, nerve root lesions, degenerative disease of spine, osteoarthritis, as well as rheumatic and musculoskeletal causes. These patients sometimes may need nerve connection studies or MRI of the back for assessment, and they might benefit from simple techniques such as a heating pad or using special soft cushions or sometimes relaxation techniques. A range of motion exercises could help these patients. And some patients may find some relief with the acupuncture, feedback, and hypnosis, although I think these are just individual experiences and they could be only transient. If these symptoms don't improve, then they should discuss with their neurologist so that further workup can be done. And also, if the sensory symptoms or pain are more prevalent in the off periods, then the patients should discuss with the physician, and their dopaminergic medications, if adjusted, they could help. And if the pain is due to polyneuropathy, then medications such as gabapentin or pregabalin and sometimes tricyclic antidepressants could help. Toe cramping is another cause of pain in the legs. So these patients with toe or foot cramping, they have pain usually early in the mornings. They will be sleeping fine. When they go to bed, they are okay. When they early in the morning, they're still sleeping, they would notice their toes going flexing or curling, their foot could go curling. Usually in these patients, this happens when the dose of dopaminergic medication wears off and there is less available level of dopaminergic medication in their plasma. And if you adjust their dopaminergic medication, such as taking a early morning dose of levodopa before the time of cramping, or sometime adding a dopamine agonist at bedtime, or a controlled release levodopa at night, could help, especially if patients sleep late in the night. In addition to this, other causes should be ruled out, such as plantar fasciitis, because plantar fasciitis also causes foot pain, and that foot pain is usually early in the morning. It's usually in the heel, and it's maximum when patient gets out of the bed and puts their foot on the ground to start walking. They feel the most pain at that time. Some reports suggest that physical therapy might be helpful. These patients could find some relief with the biofeedback or splinting, or probably stress management as well. Various types of exercises have been recommended, as well as relaxation therapies. In younger patients, the toe or foot cramping early in the morning could be a presenting symptom. I had a patient who was seen, and he had very early symptoms of Parkinson's disease, so he was on a very milder drug. He was on Rezagiline, which is a monoamine B oxidase inhibitor, and every time I would assess him, he would say that he's doing fine, there is no need to add levodopa. Once he came for a follow-up, and he reported to me that now he wakes up early in the morning, around 4 or 5 o'clock in the morning, and his foot goes spastic. It causes a lot of pain, and his toe cramp, and the foot and the toe curl early in the morning. And he called it like an alarm clock. He said, I don't need an alarm clock. I wake up early in the morning because of this reason. And so then I discussed with him. I said, probably this is the time to add levodopa, especially maybe late at night time, so that you are fine in the mornings. And so toe and foot cramping could cause a lot of discomfort to these patients.
Very good. You mentioned something about the dopamine dosage maybe low and causing cramping. So are Parkinsonism medications related to the leg cramps?
Leg cramps occur with such a high frequency in general public that it's really difficult to relate them with Parkinson's disease medications. In some patients, there have been reports that when the Parkinson's disease medications wear off, then they feel leg cramps become worse, or sometimes they are awakened at night time, because leg cramps usually happen at night time after patients usually goes to sleep, and they do cause repeated awakenings. So the leg cramps make the leg go into a abnormal posture, and the muscle hardens up, and you can actually see the muscle and the leg going into a cramp. And this may last for several minutes, but it does occur again and again. And there has been some reports that the dopaminergic medications, when they wear off, that time may be a time for the leg cramps at night time in these patients. And if they take a dose of levocarb, then these symptoms might improve. Usually the leg cramps are unilateral. They would affect one leg or the other leg. Bilateral leg cramps could happen, but they usually don't occur simultaneously, that both legs going into this spasm. And these happen usually after patient goes into sleep. And sometimes they could improve with the dopaminergic medications, as I mentioned, and other times they may not improve with the dopaminergic medications. Sometimes leg cramps could be due to low electrolytes such as potassium levels or low serum calcium, and sometimes they could be accompanied with other symptoms of polyneuropathy or degenerative disease of spine, and therefore addressing these patients might help. Sometimes the massaging of the leg muscles could be very helpful in these patients. Using a heating pad, some patients report sleeping under a loose sheet could help because it decreases the pressure on the legs. Stretching the calves could help. If patient stands up, this relieves the abnormal posture of the leg, and the cramps would go away if they stand up. And sometimes if they stretch their legs, keeping the whole leg straight, and then going their toe and foot in dorsiflexion and plantar flexion, so that type of exercise could help in some patients. Drinking ample amount of fluids so that they don't have electrolyte deficiencies is helpful in some muscles, and also keeping adequate nutrition with the minerals might help. Some patients report their own reports, individual reports, that coenzyme Q10 help them. So there is not a a set treatment which would work in every patient, but some patients find different methods to be helpful. Other patients find other techniques to be helpful for the leg cramps.
Very good. How is restless legs syndrome related to Parkinson's, and how do you treat that?
Restless leg syndrome is an entity by itself. So it could occur in patients just as by itself, those who don't have Parkinson's disease. But in patients who have Parkinson's disease, the prevalence of restless leg syndrome is higher than common public. In general public, restless leg syndrome could occur between 7 to 10% roughly, but in Parkinson's disease patients, up to 15% or sometimes up to 20% prevalence has been reported by different reports. So it seems to occur with an increased frequency in patients with restless leg syndrome, in patients with Parkinson's disease. However, the intensity of restless leg syndrome could be milder in patients with Parkinson's disease than just having the restless legs syndrome. These patients usually have a desire to move their legs, and it occurs in the evenings, and it is improved partially at least by walking, and it does interfere with sleep. So they could have trouble falling asleep, and therefore they don't have a good sleep at nighttime. This leads to excessive daytime sleepiness in these patients. Some patients may find difficulty sitting in a fixed posture, stationary during the day. Suppose if they have to take a ride in a car as a passenger, so they have to keep on stretching their legs. And also if patients have to take a flight, so they may have to stand up and walk around. And I have had incidents happen to me that patients requested, some of the patients requested me a letter when they were taking a long flight, that a letter should be given that they are allowed to walk around in the plane, because sometimes plane staff, they don't like people to walk around because of the turbulence or other causes. Patients could fall. So I have given sometime these type of letters to the patients. So they have to get up from the seat and they have to walk around just to relieve their symptoms in the aisle of the plane. So low iron levels have been related in addition to Parkinson's disease with restless leg syndrome, and usually symptoms of restless leg syndrome occur before falling asleep, as compared to leg cramps, which usually occurs after patients fall asleep. And also the symptoms of restless leg syndrome usually involve both legs, and therefore it's called restless legs syndrome. As compared to leg cramps, the leg cramps could occur in both legs, but simultaneously having a cramp in both legs may be a bit unusual, and some patients may have a leg cramp in one leg and then in the other. But the symptoms of restless leg syndrome mostly occur in both legs at the same time. In addition, the restless legs syndrome symptoms could involve arms or upper limbs. So there have been reports. Therefore, sometimes we use the word restless limb syndrome for those patients who have symptoms in the upper limbs. So these patients, they can't see anything as compared to the leg cramp. In the leg cramps, you can see the muscle hardening up and the abnormal posture of the leg, or the leg going like jerking. But in patients with restless leg syndrome, you don't see any muscle cramping or any muscle going into abnormal posture or hardening. It's just a feeling of the muscle. The pathophysiology of restless leg syndrome may have some overlap with Parkinson's disease, because both of the conditions do respond to dopaminergic medications, although the exact overlap is not known. The true prevalence also becomes difficult to find out in case of Parkinson's disease, because some of the sensory symptoms of Parkinson's disease could become prominent in wearing off periods, and they could be quite overlapping with symptoms of restless leg syndrome. It is difficult to say that restless leg syndrome is a risk factor for Parkinson's disease. I think we need more research for this. At this point, there is no consensus. But yes, it is an important non-motor symptom of Parkinson's disease. So these patients have to have certain certain features to be called restless leg syndrome. They have to have a desire to move their legs, and their legs may have paresthesias or dysesthesias, especially at rest, and it should partially relieve by walking. They should feel a feeling of restlessness, and these symptoms could interfere with their sleep at nighttime, and the symptoms of RLS could be quite disabling for some patients, because they have to get out of the bed at nighttime and walk around. Then they try to go to bed, and then the symptoms of restless leg syndrome start becoming again bothersome, so they have to come out of the bed again. So they keep on walking at nighttime many times back and forth in the room just to relieve these symptoms. So when these patients are seen, again, certain conditions should be ruled out, such as polyneuropathy or other such as low iron or renal failure. These things are associated with restless leg syndrome. So these patients may require some serological investigations or nerve connection studies as well.
One thing I was surprised at when I heard you talk about Parkinsonism was that at nighttime a lot of the symptoms kind of quiet down, and you're saying that doesn't happen with cramping. It happens with some of the tremors, but not with cramping, correct?
Right. The movements, abnormal movements such as tremor, would decrease, or even other movement disorders such as chorea or hemifacial spasm. These movements may disappear or usually disappear in sleep, as well as tremor or Parkinson's disease. It does disappear in sleep, but with respect to leg cramping or restless leg syndrome, or maybe periodic leg movements of sleep, they do appear either just before sleep or during the sleep. So it's like it's different than the abnormal movements which we see in patients with movement disorder.
Okay, that pretty well covers things. Anything else to add before we close?
With respect to treatment of restless leg syndrome, if there is a secondary condition associated with restless leg syndrome, addressing that condition could help restless leg syndrome. Otherwise, usually we use dopamine agonists for the treatment of restless leg syndrome. They're still considered the first choice medication. Usually these patients may respond to lower dose of dopamine agonists. Sometimes we just give it once a day, although the dopamine agonists are a 3 times a day medication in most cases, like the pramipexole or ropinirole. But if you take it once a day, maybe an hour before falling asleep, that should be sufficient. In other cases, if their condition worsens, they could take in the evening time and then at bedtime. And now we have rotigotine patch available. The rotigotine patch is once a day patch. You don't have to take medications orally. The patch is applied on skin, and it's good for 24 hours. So that is another progress in the field of restless leg syndrome, and many patients find it very helpful, because they don't have to take medications orally, since they are taking many other medications for associated conditions.
Very good. Okay. Thank you very much for that excellent presentation on leg pain and Parkinson's. This video can be seen at Parkinsonism.tv, and we'll be continuing with more Hangouts shortly. Thank you, Dr. Rana.
Thank you. You are